Well, I think the difficulty is when Mr. Johnson uses language like it being inhuman to cancel Christmas, you know, that's a very mixed message for people to hear, because what they're hearing from the government is somehow that they'd be behaving in an inhuman way if they cancelled their Christmas. I mean, none of us want to do that.
Forgive me,
I have
wasn't
an
he saying,
father.
and I do want to hear that, wasn't he saying that it would be inhuman for a government to cancel Christmas?
Yes, but what people hear from that sometimes is the message being that somehow they would be also therefore inhuman if they cancelled Christmas. And people do feel guilty about it. I feel very guilty about now not having Christmas with my elderly father, but he's 85, he has several other very serious health problems, and I'm also having to weigh up whether I, as a frontline worker, and my husband's a frontline NHS worker, coming into our household when he's just about probably to receive the vaccination sometime in the next few weeks. I think there's also an argument for saying, how is that going to feel for all of us who are mixing with very elderly, vulnerable people? If, because we're being made to feel somehow that we'd be inhuman to delay our Christmas, that we actually might be, I think, exposing people unnecessary, because this is a soon-to-be preventable illness for people who are vulnerable. And I'd like to have seen the government be much, much clearer in their messaging about that. Instead, we're hearing this sort of mixed, wishy-washy messaging that I'm afraid we've had throughout this.
What about people's mental health? We hear her on LBC, and I've heard it day after day from people suffering great anguish, to say the least, because they haven't been able to see their loved ones for most of the year.
Completely get that, and I obviously am in clinical practice also hearing people who are really, really suffering from loneliness, and completely get that. But I think what you also have to balance up is that this isn't just like the flu. This is a really serious pneumonia-inducing virus, and it's really not a nice way to go. It's a horrible disease for people, and it's also the effects of long COVID that can affect people, including people's mental health, for months, possibly years to come, and the impact on the mental health of care workers who are absolutely on their knees in parts of the country. I mean, in my part of the world, down in Exeter, the hospital is on the highest level of alert because they've got 400 odd staff off sick, and the system is under immense strain. And what we know from the experience in America was that when they had this mass mixing over Thanksgiving, it was a really huge super spreader event. And so I would say to people, yes, I completely get the mental anguish and the loneliness, but we have a vaccine now that is just in the business of being rolled out. And we have a health service that's going to be on its knees, and possibly the effect of a no-deal Brexit and the impact that will have on healthcare supply chains. And I think that the government could have been much clearer about saying, no, we know this is hard. We've come this far. We've all made lots of sacrifices. Please consider postponing Christmas, because no one's saying cancel it. We're just saying just hold off until your loved ones are protected. Might have been, in my view, a much clearer message to deliver. But I know this is incredibly hard. I feel it myself desperately in my own family situation.